Good afternoon, everyone. Thank you for joining us today. We are joined by Rob Bloom and Brett Shippey. They will be presenting over employee investment benchmarks. We are a smaller group, so feel free to unmute your line, or if you want to put something in the chat, I will be watching the chat. If you are watching this recording and if you have any questions, comments, please do not hesitate to reach out to me. And with that said, Rob and Brett, I'll turn it over to you.
All right. Thank you, Laura. Good, I think, officially afternoon, everyone. So as Laura mentioned, feel free to, stop us anytime through the presentation. Again, we've got a small group and plenty of time here. So we're happy to, pause. Again, this is, some follow-on sessions from the pre-conference back in October. So for those that were there, some of this is a little bit familiar, but there's also some new information that we're sharing here now that we've broken this up into kind of a series of webinars. Really today we want to talk about employee benchmarks and what becoming the employer of choice, looks like. Because of course, recruitment challenges, continue to exist and I would say even grow. So now, we're dealing with issues from well beyond just the clinical workforce. We're really dealing with recruitment challenges across the board, whether we're talking IT, whether we're talking finance, whether we're talking revenue cycle. And there are a variety of things that are driving that. And part of what we've spent a lot of our time doing when we've done, on-site strategic planning engagements with folks is really trying to look at, okay, how are we going to deal with that recruitment pipeline challenge? And then once we've gotten people to come join us, how are we going to keep a hold of them? Because again, at the end of the day, it takes successful people to build a successful organization. And there are a number of components that go into creating that environment. Compensation is obviously probably the most thought about piece of that. But there's also, overall fulfillment, right? Are we thinking about how our benefit plans are structured to maximize value, not necessarily just minimize cost through administrative effort? We want to be thinking about how are we benchmarking things, and Brett's, put together a lot of things to review based on his book of business and what he's seen out there and been successful in, particularly as he's worked with a number of CEOs on some of those key recruitment efforts. Because oftentimes, we're all using the same data set to try and say, how we're benchmarking ourselves, but sometimes that's not really capturing the true competitive environment. Operational excellence, of course, at the end of the day, a strategy is no good unless we can operationalize it. And we believe it takes top tier employees to really do that for our organizations. And then finally, making sure this is, a part of our strategic planning effort. It really can't be left out of what we're trying to do. Otherwise, we might find we lack the human resources to, move our initiatives forward. So, if we look at, sort of the breakdown of, the costs that go into sort of a fully burdened employee, at the end of the day, employees actually only sort of take home and put in the bank a relatively small fraction of the total cost of employment. And I like to remind everybody that money doesn't care how it's spent. So when we look at all of these other categories, there are a number of dollars that are being spent on carrying costs that, really reduce our opportunity to create value for the employee. And so those are areas we want to be able to focus on, whether that's within our health insurance platform, our PTO platforms, things of that nature, or even ways in which we can help minimize, exposure to payroll and income taxes. All of those things become very important as we're trying to actually create total value for our employee base. And in some cases, we have an opportunity once we start digging in and really peeling back the layers of the onion to have what I like to call a double value opportunity, which is making our lives easier, reducing costs, and making things better for the employee. So with that, I'm going to turn the presentation over to Brett to kind of go through, a little bit of definition of what does it mean to be competitive in the market space.
Yeah, thank you, Rob. And to Rob's point here, we're going to start with some of the different pieces within benchmarking that when we think about what are we doing, how are we competing against, not only our neighbors and the other rural health facilities, but also some of those other competitive fields that are pulling people, pulling RNs, pulling these primary care physicians, whatever it may be, a lot of our finance positions that we're struggling to recruit for and especially to retain for, we're going to look at those and say, okay, across this book of business, we looked at a lot of 990 information. We looked at what we have in-house and we said, what are we seeing and what can we do to help our people and help people meet the benchmarks that they're looking at, right? So for a long time, and something that Rob has talked about quite frequently within rural health, is that we do peer-to-peer benchmarking, and we say, well, we're doing okay because the person down the street who's having the exact same struggles with recruiting and retention, we're comparative or competitive with what they're offering. And so what we're trying to do is really provide you a good idea as to what these numbers are. And to Rob's point here, we're going to look at compensation, we're going to look at PTO, we're going to look at some different benefits that hopefully will help as we look to recruit and retain and really get that off of the number one problem that we're seeing within rural. And then I think again, has continued to grow instead of getting easier for us. So as we look through our book here, and a lot of the things that we've seen struggled are in these kind of the nursing RN positions, the professionals within finance, primary care physicians, of course. Any physician getting into rural is a little bit of a struggle. So we're looking at what, from a compensation and incentive standpoint, not only what do we need to be around to be considered competitive, but what puts us above and beyond those that are recruiting for those same positions. And so you'll see here that from a perspective of compensation, we've taken a few of the positions and we've said, okay, this is what we're seeing across 990 information, across recruiting websites, across our own book of business, that those who are having a high level of success with both recruiting and retaining their people are falling within these categories. And so that's really what I'm going to be talking about for these next 4 slides or so, across everything from compensation to PTO to sick time, student loan forgiveness, all of those types of pieces to say, what can we look at? And so I don't want to take the time on this call and go through every single number, but I want to point out some key pieces here that I think within these ranges that really, to be competitive, this is what we're seeing. And to start with, it's that allied health piece. Those who are having a lot of success are typically in that 10 to 15% higher range, right? So you're looking at our bell curve here. If you're on the higher side of these pay scales, you're seeing a lot higher success in your recruiting. And we've talked to quite a few of our recruiting firms as well, just to see, what are we putting in here that are pushing people over the edge. And so then you're going to see things like your sign-on bonuses. And you'll notice that in the examples, I'm putting lab techs. And so for a lot of us, that may be something that we're within recruiting and retainment. It's not just those, high dollar positions that we're talking about with nurses and physicians. A lot of us are having trouble with finance, with billing, with lab tech, with all of these roles that are not your typical recruiting. And so these are good areas where we can do different things, whether it is with a retention bonus or whether it is with a sign-on bonus, to make sure that we're bringing people in. But one of our key pieces today is not, hey, let's pay more money and figure it out that way, because within rural, we all have a lack of resources. We all struggle with these pieces. A lot of this is going to be about what are some other key ways that we can do this? How can we reallocate funds to make sure that we're doing the best we can? And to touch on something Rob said, money does not care how it's spent. So we're trying to make this something that is a strategic piece of our plan, so that for recruiting and retention, we're taking that off the top of that list. So I want to move on now into the health and wellness business benefits, because this is a key area where there is a very direct line in the sand as to what you're providing and the impact to an employee. So if you look on the right-hand side here, I've done an 80% contribution to a plan, and then I've juxtaposed that here with a 60% contribution, and the out-of-pocket over a 5-year span that you're going to see from an employee. And you'll see that the difference, it's going to start at a minimal number of about that $8,000 range. But as it grows, there's going to be a huge differential in over a 5-year period for a family in particular, that the impact to what they're bringing home. And this jumps back to what Rob was saying, in the sense of, although our salaries may be competitive, what are we doing on the other side of that to make sure the employee is taking home the most that they can? And so this is an area that we've seen where, from a rural perspective, we can be highly competitive because it may not be in the salary that we're making a big difference, but it's making a big difference to what people are bringing home. And so you'll see different things on there, just a simple number of the premium dollars that you're covering, whether it is a higher or a low deductible plan, can make a difference over 5 years of about $45,000. And so one of those key pieces that we want to talk about, and we'll show some examples later on in this, is just the better ways to do this to reinvest some of those funds that we're already spending, that we're already dealing with, to better account for what our people are bringing home. Because at the end of the day, that's going to be one of their top factors, is how are they doing financially themselves at home. And one key piece here, again, I don't want to go through every single line of this, but one of the key pieces that we've seen within the mental health space, especially over the last 4 or 5 years, telehealth has done huge expansions within the mental health space. And so that is a key piece here that we've seen a lot of people have success with, that has a very minimal cost or no cost in a lot of cases. It's built into the insurance benefits you're already offering, but there's no education around it. And so that's something I want to point out, that both from a facility perspective, if you are offering these services, but also from our own employee perspective, to ensure that we're providing something, but also making them aware of what's available to them. Because in a lot of cases, when you're talking to an employee, and I see this every day in what I do, they aren't even aware of some of the things that are provided to them, right? We all get that booklet on the benefits that are there, but how many of us read that booklet? And so this is a key piece, I think, for us that I want to touch on, is ensuring that we're making people aware of what is available to them and not spending resources to ensure that it's available with very little utilization. Okay, and this is another piece from a paid time off perspective, whether it's sick, whether it's vacation days, that we can look across the board and see a very easy line in the sand that says, if you're offering this, you're having better luck maintaining and recruiting high level employees. And so to jump back to these successful people that breed successful organizations, this is one of those lines in the sand that say, when you're offering 20 plus PTO days, or when you're offering 6 to 12 weeks paid parental leave, these things are huge pieces that people point at and say, this is why I'm here. This is why I'm staying here. And they go and tell their colleagues, they tell their peers about what's available to them. People aren't open to having conversations on compensation as far as they are open to having these types of conversations around their vacation days, parental leave, those types of things. That, and a lot of times, it's during the worst or during the most busy times of their own lives that this really provides a major benefit for them, and they see that. So this is one of those pieces that, if you're looking at the numbers here, and we'll make sure, of course, with Laura, that this is available, that when we look across the book of business, when we look at all of the fringe benefits available to a lot of our clients and the people that we're working with, these are the areas that we see a lot of success with, whether it is the 15 days of sick leave, the 12 weeks of parental leave, or when you're really looking at those highly competitive positions, the 20 plus PTO days that really provide a major benefit for people. Okay. And then from one of our last pieces here for the benchmarks, we've got one more after this. The biggest piece I want to focus on here is, especially for our highly compensated individuals, traditional retirement plans don't work for them. And this is something that many of you will have seen year over year, as physicians and executives are unable to maximize their 401k, 403bs, because of the difference between what your CEO, what your physician is making, what your housekeeping staff is making, right? So we've all got to fall into those ERISA or the IRS's rules around discrimination and ensure that we're meeting our tests. And so one of the key pieces there is that low number that we're able to contribute as a $23,000 as it comes to 2025 here. $23,000 a year that we're able to contribute to your typical retirement program does not meet the needs during retirement for your highly compensated individuals. And so what we're comparing here on the right side of the screen is some different options that we've talked about in the past and that we'll continue to talk about here, as Rob mentioned, as we expand on this series going forward for the next few months. The actual huge advantage that you see for your people. So here on the right of the screen, you're going to see this is an example of an employee making $100,000 a year. And the 6% match here, there is a pretty typical area where we see within a 401k or a 403b. You'll see that, at year end over 30 years, they're going to end up with about $200,000. And so being able to put funds in there at this number, $200,000 doesn't take you very far, especially as these grow, as markets change, as these things are impacted. We want to maximize what we're able to provide for people. And so you'll see that within that enhanced plan that encompasses both the 401k, 403b, a defined benefit, deferred compensation, a range of different things that we're able to provide for our key employees, and that we're able to do on a discriminatory basis to ensure that we're meeting the needs of our recruiting and retainment. There are a lot of benefits that we can offer that get that number up to more than double over that same time span. And so that's one of the key pieces that we'll talk about here within the benchmarking. Not only where do you need to be for your traditional retirement, where do we see that across the board, that you'll see there with that 4 to 6% match, but then what else can you offer? Because that has become one of the standard offerings that people expect alongside things like health insurance. Now it's saying, what else can you do for me to ensure that when I retire, I'm not going back to work? And that's one of the things that we'll talk about as an example here later on. And of course, further down the line, when there's another one of these webinars, there will be more information around some different options there. Okay. And then the final piece here from me on the benchmarking is around something that I know a lot of people are already doing within that tuition reimbursement, and there's several programs out there to do this. I have heard that there are some issues from an overall administrative standpoint here, and there are different programs that we can talk about and we'll talk about down the line to make that easier, to make it a single payment, kind of remove a lot of that one-off issue that people have, that we have within rural, where each individual coming in has a different program, they have a different deal, whatever it may be. And so it's a lot of signing checks and getting things taken care of. But the point of this slide really is when we're looking at benchmarking, and I mentioned this earlier, one of the key pieces we're trying to do is ensure that our people are bringing home the most that they can, and to ensure that their lives are easier, as stress-free as we can, because those are the people that are going to stay. They're going to have successful careers with us. And so one of the key pieces here that you'll see at a $100,000 loan for a physician or really any position at an 8% interest rate for a financial loan, if you're providing $10,000 a year towards that loan, you're going to see a significant drop over the life of that contract. However, you'll notice that even though it's been 10 years, that would be $100,000 that the hospital itself has put in or the facility itself has put in, you'll see that the loan still bottoms out at $70,000, or a little over $70,000 based on that interest rate over that time. Now, if we're not doing anything for the tuition or reimbursement and the individual themselves is on the hook for that, that's a significant stressor for them. It's one of the biggest things we hear about within all of our surveys, within all of our clientele, is that people are worried about what's coming or what's happening with student loans and the impact that it has on their day-to-day. And this is the biggest area, I think, that you'll see, the easiest low-hanging fruit due to some of the reimbursement models and things that we can get paid back for this, that we can take care of. And there's a lot of programs out there. I think we just presented with NoSOR, and one of the conversations that 3RNet had was that they have some solutions and different things like that. So I want to make sure this is on there because this is a key piece that I see a lot of as we've had these conversations, but you'll see it does make a significant difference to your employees as we look towards benchmarking and seeing how we can compete and remove the recruiting and retention from our concerns here in the next 5 years. Now, I'm going to pass this back to Rob. That's it on the benchmarking, and we're going to talk about some different examples that we've seen, as well as a brief overview of what we see as a high competitive benchmark.
All right. Thanks, Brett. So as Brett mentioned, we really just, wanted to highlight here really a lot of what Brett had in there, just to kind of have a single take home slide. But, when we're talking about, base pay, Really, if we're trying to drive this strategically, we're going to find, to really recruit, particularly those sought after positions, we're probably going to have to be, in the 10 to 15% range above our competitors to actually drive decision making, particularly if that's going to result in, an extended commute. From a sign on bonus, again, depending on the role, there's a wide range here. But there are also some ways we can structure those bonuses as sign on slash retention. And you can even couple it. If you look down below there, you see deferred compensation. It can actually be structured in one of those to provide some additional protection for the hospital in case it doesn't work out. Because of course, if it's these, you can make it so that there's essentially a vesting period to have fully earned it, and put the hospital in a position where they're not actually trying to go get that back, because we've seen that fail more times than not because people just don't want to take that position. Health insurance, we're talking about, covering more than 80% of the cost of the health insurance platform on behalf of the employee. PTO, 401k match, again, somewhere in that 4 to 6% range seems to be fairly competitive. Deferred compensation, I think this is an area that's probably under leveraged. We don't see as much of it as I think ought to be out there in the market. Because again, it's one of those things that can help create that stickiness between the employee and the organization, particularly because number one, of the value creation of it, but also the extended vesting period, particularly if it's structured in a cliff style, so that there's really a financial disincentive to leave the organization. Student loan repayment, again, we do have some IRS issues to sometimes deal with here in terms of what we're allowed to do, even if it's tuition reimbursement, before we start tripping some reporting requirements. But it's another thing that really generates a lot of value for the employees, because we find oftentimes we can grow some of our key positions if we can help our folks get there. And so, we want to kind of pivot now into talking about, just a very simple strategy. And we were able to partner with, a hospital in Oklahoma just to do a what if. And so, one of the areas Brett talked about, and this is an area that I think most hospitals should be taking a large stare at, is health insurance. And the reason for that is we're literally buying the service that we offer. And so, what we've seen is if a hospital's on a fully insured platform, there's a tremendous savings opportunity towards going to a self-insured model, leveraging our own service capability. And it really, is a function. There's nothing complex about it. It's just, structuring the plan in a way that works for the organization, as well as creates the appropriate employee incentives to leverage essentially what is our excess capacity, which we by definition have. It does take a certain level of active management. And at the end of the day, it all piggybacks off the concept of a domestic network, which in its simplest form is services that we provide as a hospital, right? We can continue to grow that and create some partnership relationships over time. But at the end of the day, our costs don't go up to treat a member of our staff or one of their dependents, because right, we were going to have the lights on, the doors were going to be open, the staff was going to be working. We have just minimal variable costs that could go into almost any episode of care. And I would say that would go all the way through if you were doing something more complex, like say, an orthopedic case, because you might have to buy an implant, but probably didn't have any more staff working that day, and you were always going to buy the implant, even if they went to a hospital down the street. So, tremendous savings opportunity here. And so as we start to sort of model this out, this graph just really represents different hospital scales and what the annual spend is. But there are serious dollars here. This is one of the areas where if we're trying to work through trying to find dollars to create some of these other benefits that Brett has talked about. This is an area where we can pretty reliably usually find a pretty decent six-figure number to allow us to reinvest into our employee base. And essentially, at the end of the day, what are we doing? We're trying to do two things. We're taking dollars that today we're either paying to, one, our competition, or two, to our friends at the insurance companies. And I don't like to have them have any more of our money than they already are keeping on us, right? So that's really, there's no magic here. It just works out. So for this Oklahoma CAW that we looked at, the savings potential for 52 enrollees, and so I believe in Oklahoma's 50 participants to be self-insured. the savings potential was about $146,000 a year. And so, it's pretty significant. And, we'll kind of roll into the next piece of the presentation, and you'll see, what could be a theoretical reinvestment of that $146,000. And I think the next session in the series is actually diving a little bit more deeply into this concept of this health insurance model. And we'll actually hear from a CEO who has implemented and what their experience has been with it. So I'll turn it back over to Brett to kind of go through, what could a theoretical reinvestment of those dollars look like?
Yeah, thank you, Rob. And so what we're going to look at here is one of the things that I had mentioned prior, and Rob touched on quite a bit with the deferred compensation as well, is to look at, okay, we now understand that if we were to be this Oklahoma COF that we have as an example, we've got about $146,000 in difference between what we intended or what we budgeted to spend for our health insurance. And we want to know what the best way to reinvest that is. Money doesn't care how it's spent is kind of the key piece here. And we want to know what can we do to better keep or recruit new people into the key positions. And so we have an example here in some of that deferred comp in which we've taken 5% of our top 23 employees out of, you see 52 enrolled there. We've got 23 employees that we need to make sure that if they were gone, that we'd have some significant problems at the facility. And so we've taken those 23 key employees and we've said, okay, we want to provide them either a 5 or 8% of their total salary into a deferred compensation program, much like Rob was talking about, that has a 10-year vesting schedule, has the capabilities of protecting the facilities, but also ensuring that for an employee, they can look ahead and say, okay, if I'm here for the next 10 years, I'm going to have this number roll out to me. It's not underneath any kind of limitations from the IRS or anything like that. And it's not locked away, so I can't access it until I'm 59 and a half, similar to my 401k. So I can genuinely say that in however long it is, 10, 7, whatever you decide as a facility, I'm going to have this amount of money roll out to me. And the cost to the CA, you'll see here, at 5% for those top 23 employee salaries is $151,000 a year. So what I want to come back to here as I move forward is we saved, by making a simple change within our health insurance, $146,000, maintained the same level of benefit or better for our employees, gave them and again, we'll talk further about this in the next session, gave them a higher level of care within our facility. And if we wanted to take our top 23 people and give them an additional 5% bonus of their salary into these deferred compensation, we'd have to put $5,000 above and beyond the savings in to do that for them. And so within a facility like this, where that $146,000, of course, it's a significant number of percentage of what they're currently spending, but you're saying that almost half of your facilities enrollees are able to receive the 5% bonus without a significant influx of cash from yourself because of the savings that you're able to create. And so when we really talk about reinvesting and providing for our employees and meeting certain benchmarks, we understand that there has to be other ways. How can we go find these dollars without getting new resources, without having these things come in? And so to do that, our goal is to say, here's a way to provide a higher level benefit to improve upon what we're doing for our employees on the health insurance. And by doing so, giving us a capability to reinvest some funds into another key piece of this within that retirement, that deferred compensation that, oh, by the way, has them tied to the facility for an extended period of time based on the decision making that you decide. So it really gives a lot of different options and gives capabilities to meeting these different benchmarks that we're seeing when we look across multiple books of business, the 990s across the country, these different areas, to ensure that in Oklahoma, we're competing and providing the best level of benefit that's going to ensure that people are looking and coming to rural Oklahoma for their jobs after college.
All right. So happy to open up now to any questions.
And we know it's a lot of information to throw at you as well. There's a lot of different pieces to this, and we do want to expand it as you mentioned a few times here, this is something that is going to have multiple months to go into deeper dives into this. This really just kicks it off, gives an idea of what our goals are, where we want to be at, and what we can look at providing.
We do have a part two, Rob and Brett, scheduled for March 12th. You want to give me a heads up of what we'll be talking about on that call?
Sure. So the March 12th is really a deeper dive into the health insurance side, with the thought process being that first we want to free up the dollars to then be able to reinvest into some of the other vehicles to try and improve ultimate value to the employees. And we'll have on that call Rich Duval, who's CEO of a 2 critical access hospital system that has had this in place for a number of years now, and sort of what they have experienced through that journey, to include a few positive spinoffs that really were not part of the concept at the beginning, but have worked out very, very well. Incidentally, should any questions pop up, he also does have the deferred compensation that Brett was referencing, or at least a form of it, that he's used, I think, fairly successfully, from basically providers down to, I think he's got actually every manager in the facility on that now, right?
Yes, he does.
So
both facilities.
Okay. So again, it's one of those things where that's a point where you'll have a hospital CEO who has done some of these strategies, and I would say feel free to pick his brain as well to the extent that you have questions that pop up between now and roughly a month from now.
Well, I'm not seeing any questions come through the chat. Last call, if anyone had a question or comment. If not, like we just mentioned, we do have another call scheduled for March 12th. And that could be a great time as well to share this with your team members. We are recording the session. Once it is posted to YouTube, I'll be sure to send it out with the slides. So if you have any questions, it sounds like we'll have a great discussion on March 12th. But real quick, I'll check the chat. I don't see any questions coming in. Rob and Brett, thank you so much for your time today. And everyone have a great rest of your day.
All right. Well, thank you very much.
Thank you, Laura.
Thank you all.
Have a great day, everyone.